Hey folks, so one of the biggest parts of the body is that people really underestimate how freakishly stiff and tight and weak and really gnarly that they can become. Your fingers, hands, wrists, and forearms. And this is an area of the body people are always really surprised by how obnoxiously god-awful digging into the muscles of their forearms are. And they find out how stiff their joints are. They find out how little range of motion they actually do have. So I wanted to share with you, how do we actually help to open these up, help to gently relax the tissues of your forearm? Because what we're talking about here, this isn't really about your fingers, your hands, your wrist, your forearm. This is about your grip strength. Now, how much do you need your grip strength? How much do you need your grip throughout the day? If you're driving a lot, if you do any kind of exercise, doesn't matter what it is, you need your grip. And the stronger your grip strength is, the stronger other things can be. For example, like so many people, I've been coaching deadlifting for so many years, and what happens a lot, especially with beginners and even intermediates, is that somebody might max out on their deadlift, but they say, I just lifted really heavy, but I didn't feel anything in my glutes and hamstrings because their grip was such a limiting factor. Their butt and their hamstrings can technically support a hell of a lot more load, but they can't physically pick up the weight because of just their hands and their forearms. They're so stiff and they're so weak. Why would this be the case? Well, how often are you using your hands without doing any kind of real care for them? So all the writing, all the typing, all the driving, all day long for years and decades. And if you're not doing anything to really rehabilitate from that, it's just a little bit of tension, but it's a little bit of tension every single day. And that adds up after 10, 20, 30 years. And now people are like, oh, carpal tunnel syndrome, that's just a part of getting older. No, that's a part of you just being abusive towards your body and not doing anything to really help yourself, usually just because people are ignorant of the matter, which is why this video now exists. Two really simple, extraordinarily simple things that you can do to help this out. Every single day, take 2 minutes, 2 to 3 minutes per arm. So you're talking 4 to 6 minutes grand total in your day. Massage ball, just the one ball, don't use a foam roller or a lacrosse ball or anything else. You're gonna think about massaging out your palm. We're gonna focus just on the actual musculature, and it kind of makes this U shape around your palm. So as I'm massaging through, I'm going to be moving my hand in a way that gently and slowly massages over this. And that's it. So I want to spend about a minute or so on this, and then we're going to move on to the forearm. Now, how simple and easy is this? How often you could do this while you are watching telly? Easy. You can do this while you're brushing your teeth with your other hand, and then when you're done with this hand, swap sides. Ooh la la. The point is that you can find time to do this anytime you have some downtime. Even if you're at work, if you have a desk job, just take a minute here and there. Literally, maybe during your lunch break or actually during your work. Go to massage out your hand, and then you're going to take this. You need both hands kind of free on this. You're going to massage up your forearm. Now we're going to focus on the top of your forearm. So we're thinking the back of your hand up to your elbow. You can't do the bottom. You just have to be extraordinarily gentle on that bit. You're not really trying to get deep on the bottom so much, but on this side you are. We're going to explain that later on, but basically I'm going to do two major things. One, I'm going to create massage. So I'm actively rolling the ball up and down, side to side across the muscles. And it's usually what I was referencing earlier in the video is that when you get up close, the bulk musculature is up near the elbow, you roll over that perpendicularly, it's usually awful for folks. And because what they find is they find out that this is their grip strength. You grip with your hand, it's not this that gives you the strength, it's all of this. And this is what's constantly twitching, constantly engaged for so long. So for most of you, you want to be really gentle with this. Now what you want to do here, as I said, roll that over nice and slow and gentle. And you're doing that up, down, left, right, side to side, northeast, southwest, wherever. And then you also want to, and this is part of why you want a proper massage therapy ball, you want to pin it, spin it, and shear the skin around. So pin, spin, and mobilize all of that. And you want to do that all over, top and bottom. The bottom's a little bit more actually exposed, but you have your major nerves, arteries, blood vessels that run across the bottom. So sometimes people can be a little bit more delicate in this area, as in you don't want to put in a whole lot of pressure. Sometimes people feel like, oh, they kind of ping something down in there and it's not nice. It doesn't really feel the same as a place that's so densely populated with skeletal muscle. But anyways, you want to spend about 1 minute on the palm, 1 to 2 minutes up on the forearm, and then do the other side. How easy and how simple is that? And this is not only going to restore a lot of grip strength, but also help to remove, albeit probably gradually, tension excess soreness, just pain maybe that you might have from a workout or a BJJ class. So if you do Brazilian Jiu-Jitsu, how often do your fingers and your wrists come under threat and get really sore, really achy? This is going to help you to heal a lot faster so that you can get back into training quicker and have more adequate training because you healed faster. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.